Hello, we are going to talk about CT scan parameters. With increased number of CT scans done, it is also important to understand the CT scan parameters if we are to optimize the protocols. For example, there are a variety of factors which influences both the radiation dose and image quality in CT. Normally we can group these factors into categories such as primary factors, which have direct impact on the radiation dose and also image quality, secondary factors and other factors. I am going to talk about the primary factors, especially one of the factors such as tube current. The tube current is one of the primary factors in CT because the tube current indicates the quantity of X-rays. The tube current and also MAS is the amount of X-ray produced in the X-ray tube. In CT, as the tube current increases, the radiation dose also increases. In fact, the increase in tube current leads to increase in radiation dose linearly. At the same time, increase in tube current also leads to a decrease in image noise. There is always a trade-off. One has to make a decision about the image quality and the reduction in radiation dose. But it is important to remember that the radiation dose reduction should not jeopardize the image quality. For example, this simulated images shows the image noise and the image quality along with the radiation doses. If we keep all parameters same, if we just increase the tube current from X amount from 69 mA to 184 or 69 mA to 48 mA, the radiation doses increases linearly on either side. For example, it is important when we are modulating tube current to look at the diagnostic need of the particular image. Shown in this particular example here is the interplay of radiation dose and image noise. In the 4 simulated images, if the final clinical indication is to look at the renal cyst, it is visible even when the tube current is about 50 MAS. Therefore, if the indication is look at for the renal cyst, one does not have to scan a patient at 200 MAS. Decreasing to 50 MAS is almost decrease the dose by 1/4. On the other hand, if somebody is looking at in the conspicuity of small liver vessels, then the image quality is also key. Then the very low MAS may not be sufficient to visualize these conspicuous vessels. So it is important to understand the CT dose in terms of the tube current and image quality. The second important parameter is the tube voltage. The tube voltage defines the quality of the X-rays, and historically we have been using 120 kVp. These days the studies have shown it is advantage to use a lower kVp on thin patient. The third important factor is the pitch. The pitch especially applies only to helical CT scan. Pitch is the ratio of the table feet per rotation divided by the total X-ray beam width. Therefore, if the table is traveling much slower than the beam width, that indicates a pitch less than 1, which there is a tissue overlap. And a pitch, if the table is traveling much faster than the beam pitch, that can indicate a pitch greater than 1, which indicates there is a gap in the tissue in the scanning area, which also has an indication of lowering the radiation dose. Understanding these scan parameters are very important when we are trying to understand various aspects about CT dose. Thank you.